Is it time we had a conversation about potentially, dare I say it, moving away from the fully nationalised model?
Well, I caught quite a lot of what Robert Winston was saying, and quite a lot of what he was saying I wholeheartedly agree with. And I thought it was really interesting, actually, when you used the P word to Robert as a sitting Labour peer, that he didn't undertake the normal political response, which is shock horror, we can't have such a thing. The point he didn't make, but he equally well could have made, is that since the day it was founded, the National Health Service has been a public-private partnership. It was Aaron Bevan who set up the GP part of the health service, which is a fundamental part of its success, as a group of small contractor businesses working to a public agenda, quite rightly, in my view. The other example, of course, is NHS pharmacy, community pharmacy, that played a huge role in the pandemic. Accessible NHS care available on the high street, paid for by the NHS, but delivered by the private sector. Now, so if only we could get away from the idea of public good, private bad, or the other way round, and just look at the different elements of the health service that need to work together. And incidentally, not just the health service, Robert also touched on social care. There's as many people employed in social care in the UK as are employed in the health service. And it's time we started to think more constructively about how the two caring sectors, the social care and the health service, work better together.
My mum was a long-standing employee of the NHS, and she used to sort of, grumble every time a new health secretary came in and moved the furniture around a bit, and, people thought, well, what's this going to change? You've been a former health secretary. Sajid Javid has, made big promises about renewal and reform. How much has he got his work cut out for him in order to do that?
Well, I think the biggest mistake a health secretary can make, and I made plenty, I tried not to make this one because I'd already been a junior health minister and knew that it would be a mistake. The biggest mistake is to imagine that you can tear up all the current legislation and reinvent it all and have a new model and a new reformed health service, which suddenly on some D-Day 2 years on, when the legislation takes effect, achieves a new Jerusalem. That's not how life is. The health and care system together, which I emphasize the point, they absolutely have to work more closely together. The two sectors together are more than 10% of every employed person, every pound spent. They're more than 10% of all economic activity in the UK. So you can't just reinvent these sectors by passing an act of parliament. What you have to do is to work to develop ideas that will deliver the core objectives that are actually shared right across society, deliver those objectives more effectively, progressively more effectively, incrementally more effectively. And I hope that's what Sajid Javid will do.